This presentation is one of a series designed to acquaint the student and our practitioner of family therapy with the major theoretical approaches to family treatment. The presenters, Dr. Ramon Corrales and Dr. Larry Rotrock, are co-directors of training at the Family Institute of Kansas City, Missouri. On the tape you are now viewing, Dr. Corrales and Dr. Rotrock will discuss strategic family therapy. They will be thinking of strategic therapy in the larger sense of strategic/crisis-oriented therapy that includes not only the work of Jay Haley and Chloe Madanes, but that of the Brief Therapy Group at the Mental Research Institute in Palo Alto, California.
Hello. Today we're going to be doing a presentation on strategic family therapy, sometimes known as brief therapy, short-term psychotherapy. A number of names have been associated with the term strategic family therapy. Here we will be using the term strategic family therapy to cover a number of schools represented under that term. As you probably are aware, this is part of a series of presentations or tapes dealing with the notions, the different models of family therapy. And today we will simply focus on strategic family therapy.
The first point that I would like to make is the idea of therapist responsibility. When doing strategic family therapy, it's very important that the therapist assume responsibility for the change. It's very important that the therapist assume responsibility for the interview. It's very important that the therapist conduct the interview in such a way that there can be results. So it tends to be a very results-oriented, very problem-focused type of treatment, where the therapist assumes responsibility for developing a strategy that will solve the problem for which the family or individual came to see them.
That probably captures the term strategy, doesn't it, Larry, where the therapist really assumes responsibility for not only understanding the problem, but then coming up with a plan of action designed to solve that problem. And that probably captures the whole essence of strategic family therapy.
I think it does, Ramon. And of course, implicit in that notion is the idea that if the therapy fails, then the therapist has to assume a large share of the responsibility for the failure.
That's right. In fact, leading on to the second point we might make is that in this kind of therapy, there's much less emphasis on traditional concepts like feelings, cognitive insight, and so on, but a great deal of emphasis on action rather than.
That point should be re-emphasized, I think, and that is that this is not a theory of repression, that the main emphasis is on action rather than insight or introspection. Consequently, most strategic therapists that I know would not be too concerned about feelings or getting feelings out, so to speak, because it's essentially not a theory of repression. And it assumes that simply by getting your feelings out, things will not get better as a result of that, but rather for other reasons that we'll mention later.
As a result, then, there's a great deal of emphasis on techniques rather than theory, although, of course, there's quite a bit of theory associated with it, but much more emphasis on how to change a particular situation rather than simply understanding how a particular situation got to be the way it is.
It's not to say that understanding may not occur, but the understanding will occur as a byproduct of the change,
rather than understanding leading to change. Perhaps we can move on to their major theoretical formulations. We might say, to begin with here, that there's a whole variety of strategic therapists. You have people like Jay Haley and Chloe Madanes, who have notions that are not only strategic but also structural, hierarchical, for example.
Also have the people at the Brief Therapy Institute, MRI, Mental Research Institute in Palo Alto, who also would fall under the general category of strategic therapists, but who take a slightly different approach. And we'll say more about that as we go along. But some of the concepts that we'll be mentioning are concepts that will fit more with certain schools than with others.
One of the major notions that Haley and Madanes use is one of hierarchy, of course, and that is the notion who decides in the family what the power structure is. And this is one of the areas that they really concentrate on, is the decision-making process in the family. And therefore, one of the major focuses or foci of therapeutic change is in correcting hierarchies. Probably one of the major differences, Larry, between, say, the brief therapists and Haley is that the brief therapists, in my understanding of it, focus a lot more just on how families formulate problems, how they try to solve it, and then their major emphasis simply is in changing their problem-maintaining sequences. And I don't hear them being very concerned about systemic or structural characteristics of the family, whereas Haley will look at both, at least both how the family maintains a problem, but also how the family is structured as a system.
And I think that's true, Ramon. I see the main emphasis of the brief therapy group is to try to look at the solutions that have been attempted and somehow to change those solutions, with the clear implicit notion that it's the solutions that they've tried that's responsible for maintaining the problems. And once you can encourage them or get them either through some sort of task to try a different solution, that the problem will disappear regardless of the etiology, the length of time it's been occurring, and so forth.
In fact, they have a very little tolerance, you might say, for notions like etiology, how the problem developed, but more in terms of how the problem is being maintained currently in the system. And where the brief therapists and the strategic therapists, a la Haley and Madanes, merge is in the cornerstone belief that symptoms are communicative and that symptoms really have social function. And therefore, a lot of the therapy and a lot of the investigation is in finding out how symptoms, what functions, I should say, the symptoms fulfill in that particular system, and then finding other ways to fulfill those functions.
Implied in what we're saying, of course, is the idea that in both brief and strategic therapy, and we're lumping brief under strategic therapy at this point, is the idea that it's a very present-focused therapy. It tends to be very present-centered, so you would not see a pure strategic therapist spending much time going into the history of a family or even being concerned about the history of the family. The main emphasis will be on present-centered dynamics. The main focus will either be on the individual or the nuclear unit as opposed to looking at intergenerational dynamics. And you'll have a very present-focused kind of process taking place.
I thought I'd make it clear we are not referring here to the Milan group, where they like to defocus the problem, so to speak, around circularity and so on.
I might move ahead and mention an additional point or characteristic of strategic therapy, and that is the idea that it tends to be a very problem-focused therapy, and as opposed to a growth-oriented approach. It's not to say that by solving problems it does not lead to growth, but it is to say that the main emphasis is on getting in and getting out. It's to address why the family or the individual came to see you, which is to solve the problem and then to end the therapy. Now, this would contrast quite sharply with a lot of approaches that see themselves as more growth-oriented, that tend to be more vague in definition of why therapy should be occurring in the first place, tend to have a more generalized notion of the philosophy of treatment and therapy.
One of the real characteristics of strategic therapy is a great deal of concern with defining the problem focus, and also a great deal of concern with how the family, how the couple, the individual, how they are framing or thinking about the problem. And then a great deal of concern with, is that framing solvable? Is it useful? And if it is not a very solvable problem, for example, to a strategic therapist, framing a problem as low self-esteem, which in Satir's language would be something she would be very concerned about, to them that would be entirely unsolvable if left at that level. Whereas they like to define problems in terms of, is a kid going to school? Is he able to study? Is he able to do the things that, say, a 16-year-old would be able to do? Those are the kinds of problems that they like to look at and frame situations so that they can be clearly resolved.
Another way of saying what Ramon is saying is that the problem needs to be operationally defined. That if you're into the second, third, or fourth session and you do not have a clear definition as to how the problem is defined, then you're likely to be lost in the therapy, because there aren't clear operations as to how you can get from point A to B to C to D and so forth. And soon the therapy may or may not be succeeding, but you won't really know, because the initial reason why you came is so poorly defined that you simply do not know when you're getting success or not.
So one way to summarize this area of focus on the problem is that solving the focused problem, according to strategic therapists, is the major task of therapy. And once you solve the presenting problem, the problem that brings pain to the couple, to the family, to the individual, you're basically through with the therapy process, and you terminate and leave. Therefore, one of their main areas of intervention would be to attack, almost, if I may use that power frame, to attack the sequence of behaviors that maintain problems.
Might be a good point at this stage to say something about the idea of co-therapy versus individual therapy. That as you look across the country and you discuss and observe different people doing strategic therapy, you'll discover that most people do individual therapy. That is to say, there's only one therapist in the room as opposed to two. And that's probably true of therapy in general, that there's simply just one therapist present in the interview. But there's nothing that's inherently conflictual between doing co-therapy and strategic therapy.
Mindful of the fact, too, that probably most therapists in agencies and private practice do therapy by themselves or alone, we are nevertheless going to demonstrate the strategic therapy in a co-therapy fashion, simply to demonstrate that it can be done, I would say, as co-therapists. And also, since most of our training is done in a co-therapy format, we thought we would demonstrate it for training institutions. I'd like to say something about, just in general, how strategic therapists begin the process of therapy. As you probably can imagine, after some kind of social stage where you make the family feel comfortable and accepted and warm, and etc., that a great deal of the questions will revolve around, what is the problem? How is this a problem? What specifically is the problem? And so quite a number of questions around the definition of the problem as seen by the family. And I would say then followed by a great deal of questions around how the family has attempted to solve the problem, and then moving directly from there into goals and indicators of change. These would be sort of the cornerstones of the first session.
I'd like to move ahead rather quickly and rather briefly here and mention some of the standard interventions and techniques